How to identify burn severity in first aid. Imagine you see someone with a burn and wonder how serious it really is. Knowing how to tell the severity can make a big difference in providing the right help. First, you need to look at how deep the burn goes into the skin. If it only affects the outer layer, called the epidermis, it's a first-degree burn. These are usually red, painful, and might feel warm, like a bad sunburn. They tend to heal within a week without scars. Next, if the burn affects both the outer layer and the underlying layer called the dermis, it's a second-degree burn. These cause redness, intense pain, swelling, and blisters. The blisters might be superficial, just on the surface, or deeper, involving more tissue. These burns need careful cleaning and dressing to prevent infection and scarring. If the burn destroys all layers of the skin and reaches the tissue underneath, it's a degree burn. The skin may look white, leathery, charred, or blackened. These burns might not hurt at first because nerves are damaged, but they are very serious and need emergency medical care right away. Another key part of assessing burn severity is estimating how much of the body is affected. The rule of nines is a quick way to do this. It divides the body into sections that each representing about 9% of the total body surface area. For children, the Lund and Browder chart gives a more precise estimate. You can also use the palm of the person's hand, which is about 1% of the body surface area, to estimate smaller burns. If more than 15% of an adult's body is burned or more than 10% in a child, it's considered a major burn. Burns on critical areas like the face, hands, feet, groin, or around joints are more dangerous because they can affect movement and function. Keep an eye out for signs of inhalation injury, like coughing, wheezing, or trouble breathing, especially if the burn was caused by fire or smoke. These signs mean the airway might be damaged, and the person needs immediate help. Also, consider the person's overall health. Conditions like diabetes or heart problems can make recovery harder. In first aid, start by removing the person from the heat source and stopping the burning process. Cool the burn with cool running water for about 10 minutes to reduce pain and tissue damage. Never use ice or ice-cold water because it can worsen the injury. Remove tight clothing or jewelry near the burn, but don't try to take off anything stuck to the burn. Cover the area with a clean, nonstick cloth or dressing to protect it. Do not put butter, ointments, or home remedies on the burn because they can cause infection. For minor first-degree burns, over-the-counter pain relief and hydration are usually enough. But for serious burns, especially degree burns or large areas, seek emergency medical help immediately. If the burn covers more than 3 inches across or involves the face, hands, feet, or groin, it's time to get professional care. Remember, quickly and accurately identifying how severe a burn is helps you give the right first aid and know when to call for help.